Hello, everybody, and welcome to another Redox 5 webinar webcast. We're glad that you're with us. If you're still coming in, let us know in the chat where you're coming from. Tonight, we have a great program. First, we want to excuse Dr. Maureen Hayes, who's away from action tonight. She'll be back next week. We have in her place, we have the illustrious Jerry White, physical therapist. I love the scrubs he's wearing tonight. Sia branded. So we are grateful that he's with us. He hails out of Spokane. Jim and Ann Glenn are with us from San Antonio, Texas. Hello, Jim and Ann.
Hello.
And myself, my name is Lee Osler. I'm a practicing dentist in the state of Washington, where Jerry's from. We have tonight a special guest tonight. This is Dr. Ed De La Reyes, who has been a long time involved with the SIA and with our project here. Before we begin with him, we just want to make a disclosure and a disclaimer that, we are independent associates who represent the company ASEA Global. We are not representing or making claims that diagnose, treat, or cure anything. This is a cellular health company. We'll be speaking to that tonight about how it improves and helps restore health. So Dr. Ed, thank you for joining with us tonight. He's from Bowling Green, Kentucky. He is by profession a medical doctor, physician, who has specialized in anesthesiology, pain management, and he has a compelling story. We've heard it a couple of times, but he always adds some juice to it every time he does, so no pressure, Ed. But could we start off and have you maybe introduce, especially for those who have not seen or heard from you before on this platform, what brought you to ASEA? Why is this even interesting to you? Maybe tell us your story and kind of get us started that way.
Okay, yes. Thanks again for bringing me to ASEA 5, and thankful again for what you do to the field. And my group all is here. Unfortunately, some of the Fridays I am also have the same meeting time with you guys, but we utilize this, and you've been helping a lot. And thank you, my mentor, for the balance test, Jerry. I know I met you first, and we were doing the balance test in the lobbies of Cancun Airport during one of the Ascent program there. And thank you so much that you're here tonight. Lee, your books, your everything, friend. Thank you for what you do here. Okay, my background, of course, is I'm a physician. I came from the Philippines and came here to train. I trained first in pediatrics, and after training pediatrics, I was going to be a neonatologist when somebody talked me out of it and convinced me to go into acute care also, which is anesthesia, which has a varied specialty that we could do. And I'm glad I did. And with that, I took the subspecialty of chronic pain management. So I was practicing first in Washington, D.C. area. And then after that, I moved to Bowling Green, Kentucky in 2005. I was brought in to help a pain practice. And that was good because from one clinic, we made it to 6 clinics, and then from from 6 procedures a day, we did it to 45 procedures a day per physician. So it was a great achievement, but at the same time also, it was the reason why I have all my problems. So it broke my back. Every time we do procedures, we use a 20-pound jacket, and because of the number, and you're the only physician, so we handle 2 rooms, and I have 2 teams. I have 2 X-ray techs and 2 machines. I have 2 nurses, and it's just me flopping from one side to another. And then when I wear this jacket, that's 7 o'clock in the morning to start the procedure, I don't take it off until about 5 to 6 o'clock at nighttime. So it's 20 pounds carried that way, and for years doing the same routine. And in 2000, 15, after flying from a long flight, coming off from a long flight, all of a sudden I had this severe discomfort from the back, and it run down towards my foot, my right foot, and it is within my specialty. So I imaged myself and went to have myself imaged. And within minutes after the imaging was done, the radiologist called me and advised me to see a neurosurgeon. So I have a neurosurgeon friend, and I called him and I told him what the findings are. And he said, well, you need to have this one fixed as soon as possible. It's not giving you blood supply to the ends of the spinal cord. So, and I'm biased with that. I resisted it because I am a chronic pain management specialist. Most of my patients really are having this type of procedures done of them, and then it failed. That's why they are in my clinic. So I consulted four more neurosurgeons and spine surgeons just so I could be convinced to have it done. But all of them unanimously said, "You have it done. You should do it as soon as you can." So I did. I did my research and where to go. I have this group in Philadelphia. They're a group of 60 neurosurgeons and 65. And then the one that I chose was the best one. So I have an insider, a cousin of mine, who's one of their anesthesiologists. And then we kind of the one that observes who are the good surgeons that we work with. And we look at them and we see how they work. And so this insider said, hey, choose him. He's the one who's good. In fact, his specialty is to put football players back to play which has spine injuries. So, and when I look at myself, I said, well, mine was no near those severe traumatic injuries of the spine. And so I was confident that I'm going to get well. So, and my cousin said he has a 90% success rate, and that's pretty good. So I submitted myself to have this procedure done, and confident that I'm going to get well. And unfortunately, I belong to the 10%. And when I woke up, I struggled, of course, and I said, but this is just a few days. I use a walker. I had my PT. I was still encouraged. I said, this is just a normal thing. Unfortunately, I stayed that way. I stayed that way for more than a year. Cannot walk without a walker. And then I became a patient of my own specialty. So I was given medications that I myself has been writing for more than 30 years. I was on 3 controlled substances. I was on 2 controlled pain medication. And then I was on a neuromodulant that confuses my brain that I don't have pain. And unfortunately, these things did not work on me. Every night when I sleep, I could not sleep straight. I could not be rested straight. Every hour, this discomfort of mine wakes me up. So every hour, I have to change position from left to right, and that was my routine. And so I was told by my surgeon that, hey, you can't work anymore. You just done. But we could redo all this stuff. And so we imaged myself again, and according to him, everything is aligned, everything is good. But just because I don't feel good, let's just do it again. I said, I cannot take that. And then I said, most of my patients that have more than one procedure done in the back ended up in a wheelchair. So luckily, Jim did not, has 10. And So I refused having that from the beginning. So during my uh, monthly follow-up, it's always offered, but I did not. And then on my yearly follow-up, this was offered again. But at that time, things has changed. I was already frustrated and I was already really depressed. And at the time, again, I always joked that if you just give me a scalpel, I could do it myself, yank it out of my back and say, you know what? I could let this monster out of my system and out of my back, and I could feel better. So I submitted to a second back procedure. And then the good thing that happened to me is he was a busy surgeon, and it took 2.5 months before he could put the time for me and the schedule for me. And luckily, it was at this time that I was introduced to a SIA. And it was my brother-in-law, an accountant, not in medical practice. It was my wife's brother, older brother. And culturally, we truly respect our elders, what we call that. And it's just out of respect that say, okay, I'm going to take it. But in my mind, these things will never work. Let's just get it done. Let me take it, and that way, and I know what to tell him. He says, "I'm sorry, I tried this, and I really tried hard, but it did not work." So that was my spell, and because I was 100% sure it was not going to work. But fortunately, though, in just 5 days of taking it, for the first time in over a year, that I could hardly be rested is I had a good 4 hours straight sleep, no disturbance at all. I vividly remember it. I went to bed at 10 o'clock. I woke up at 2 o'clock and I said, I thought it was just 11 o'clock when I woke up and said, and I was looking at it, it's 2 o'clock in the morning, early morning, and I had the best sleep ever, well rested, just 4 straight ones that I've never experienced in over a year, exactly 14 months when all these things happen. And a good thing about it is that on a daily basis since then, after that first relief, is I had my sleep get improved and improve. My depression is the one that really also was taken out. I had a change in demeanor. My mental clarity was better, and I could think well. I could smile again, and slowly my pain levels have come down from a level of 8 to 10 to 4 to 6, and that is great improvement for me. And I could not even imagine that that's going to happen. My strength become good. And so I was a life that was changed. And I was very thankful about that. And at this time, I changed my thinking. So this thing is not is working, but I was still skeptical. At the time, from being said that this is not going to work, now I said, well, it's 100% placebo effect. And I went into that, and then until I shared it with my mom. My mom was already 90 years old at the time. She had a brain condition that would not allow her to speak. So my intention was just to let her use it so that she could also have the good sleep that I have, that she could also have the good energy that I did experience. And I was not expecting for anything else. And that's all my intentions. And I let her try it. I let her drink it, uh, uh, just 2 ounces twice a day, drinking that, and apply Renew 28 in any discomfort areas that she has. And but to my surprise, though, in about 2 weeks' time, I was never expecting this. She started verbalizing slowly by words, and then going back and then back to conversational conversation. This is 4 years into her condition, and I could not explain that in my own traditional knowledge of medicine. So I did my research. I was looking into all these things. what is this? What is redox signaling molecules? I still could not. I know when I opened up PubMed, there was already over 200,000 articles about redox signaling molecules. And I was led finally into the medical atomic physicist that stabilized these molecules, Dr. Gary Samuelson. We have hours and hours of talking about this. And the good thing is that he's just so nice, and he really loves the technology, and shares the things that he has read about this redox signaling molecules before he stabilized the molecules. And then one of the studies that he shared to me, because I was an anesthesiologist, is that, you know what? They were even trying to make this as a surgical wash. And for me, I was excited about that because all our surgical washes is just really just to kill the bacteria component, not even to kill viruses or yeast or what, just bacteria. And then, but this one would touch on those three organisms, and at the same time, though, promotes cellular healing. What could be the best kind of cellular wash, surgical wash, is this one. So those are the excitement that I have discussing these things. And then after that, it became like my personal use, like my family use, that I use it, my mom used it. And then my granddaughter had an incident also. And my granddaughter is 18 months at that time, accidentally grabbed a very hot tea, and then did some injury from the lifts down to the neck and then the chest. And because of this very hot fluid that ran into her body and causing a first and second layer injury of the skin, she screamed so much it shook us all. And so I didn't even remember it. It was just my wife that remembered. Hey, the gel, the gel, the gel, do that. So we did immediately apply that. And you know what? In 30 minutes time, while driving to a children's hospital, which is about an hour away from where I am, so we went to Nashville and go to the children's hospital in this way. In 30 minutes time after we applied that gel, is my granddaughter started playing again, quit crying, playing again. And I was a pediatrician. I know what relief is when they start playing again. And I was surprised looking at those injuries, and my granddaughter was playing again. The most surprising thing is when we went to the ER, they started cleaning. They started the breeding this. They take away dead skin so that to clean it up. And the only way that you could be assured that you got all the dead skin is to go into the live skin. When it starts bleeding, then they stop. And she tolerated this procedure. She was kind of squirmy when it was the live part of the skin that was taken out. And she did well. So we went home and we knew about this gel that is, hey, it's an antibacterial thing, and we just applied it. And as a pediatrician with this type of injury, especially involving the second layer, is that this will always be scarred, and this will always be at least discolored. She's very highly pigmented, and that is the thing that you expect. But in 6 weeks' time, this thing completely healed, and as if nothing happened. No skin discoloration, no scar tissues. And as with my pediatric experience, I was a full-fledged pediatrician. I see this type of injuries, and those things would remain, and this one did not have. So that surprised me well. And I said, wow, what is this kind? And then another thing happened to my family. And my wife, and being that we were retired, so we cannot hire any more landscaper. We do our own landscaping, and we familiarize ourselves with our tools. And of course, for short, she got injured with an electric trimmer, and that cut off the finger. Not off really. It cut through the fingernails and cut through the fingernail and violated the nail bed. When we had that, it got through even to the bone and fractured the bone. And we were told that, oh, the nail bed is violated, so that fingernail will never heal again. It will always be deformed because of that kind of injury. So the thing is, after that injury, right after the injury, of course, blood spurts and pain was there, and so we remember now we're good at this, and we know what to do. We pick up the water, we put it in a cup, and then we just soak her finger. And true to the fact, pain is controlled, bleeding is controlled, and we ran to the ER. So there we found out that the bone was fractured, and we were told that would be so sutured. They fix it, they suture it, and he forgot to remove the fingernail. And he said, "Oh, you're gonna have an appointment tomorrow with an orthopedic, so just have the orthopedics. We'll call the orthopedics to pull the fingers." Other than the nail, not fingers. I'm sorry, just the nail. So we went, yes, and this is just less than 24 hours. It happened in the afternoon, and our appointment with the orthopedic surgeon was in the morning. I wish I could share the picture, but it will gross a lot of people. So when we went there, it was cut through all the nail bed. The whole fingernails was lengthwise was cut through the nail bed, through the annula, that way. And when we went there in the morning, the third of the fingernail was already healing, and there was no cut through. And the orthopedic surgeon looking at it, so I'm not gonna remove this. It's not really fully cut. I said, oh, I showed him the picture from about 14 hours ago. And he said, are you sure? And so they say, okay. So we did. And this thing's healed in 3 weeks' time. Yes, that deformity was there. But in 6 weeks' time, again, every scar tissue that was there and the fingernail returned back as if nothing happened. Complete restorations of this. And these are the things that I have observed with these molecules that we have. So this all happened within just my family. I thought I just was blessed. I have been good to the Lord, and the Lord has been good to my family, until a neighbor of mine came to me just to ask for a referral to an orthopedic surgeon, because he has a condition, a frozen shoulder, that cannot be, all modalities that was done and nothing relieved it. So it was advised to have it fixed surgically. So he came, and of course we share an office with an orthopedic group, and I told them this is the guy that would do that. And at the time, I was not really sharing this technology. I was just doing it for my own self, for my own family. And so I remember, oh, okay, so this is the surgeon to go. But hey, I got this gel to put in there, and then I recommended the water. And then after a week, he called me, what is this stuff? And he said, for the first time, I'm able to move my shoulder freely. I'm able to raise it way up. And that was in 2017 or 18. And then until now, he still didn't have any surgery. So that was the start of my sharing this to a lot of people. And then I thought it was just really for my family. And then now I have expanded my family. And then a lot more people has been touched, and a lot more people's lives has been changed because of this technology. So it is pretty amazing. And that's why I'm always excited to give information to people, to share my story to each and everyone, so that they too can have the experience that they can with this technology. For my experience is that if you stay on it, if you give your body enough dose that you could, then you will absolutely have the effect that you intended to have. And most people would say, okay, and most people would just take really the minimum. And they would take even just half an ounce or 1 ounce instead of the 2 ounces, and do that twice a day. And after a month, and then extend it for 2 more months. And I did it for 3 months. It did not work. And I said, no, you get to, these are individual responses, and the molecules that you put in your body, you cannot direct it. I wish we could direct it. Say, hey, you know what? I will take you for my back and do that for me. The thing is, once these molecules go into your system, it will prioritize itself in which of the system needed me more. Which of you systems is more hungry for my electrons or for my molecules? And I will go there and will give it to you. And if you don't dose yourself properly, it would just go there. And the back, the musculoskeletal system that you want taken care of, cannot even be touched by these molecules. It's just busy through that thing. And so give yourself time, give yourself enough dose, and you will feel the great relief and amazing relief of these molecules. So,
And
That's
you
awesome.
have such a wonderful story. Thank you for sharing that. You actually gave five stories there. That was wonderful. So
I think I counted more.
maybe-
How much were you drinking, doctor? And how much do you drink now back in the beginning? Did you learn quite a bit through your own experience about how much you should take? And then Jerry, after that, if you don't mind piping in with the medical disclaimer and kind of give your follow-up, please, Mr. Jerry.
yeah,
Dr. Ed.
yeah. At first, I was just drinking 2 ounces twice a day, and with that dose, in 5 days' time, I had that great relief of good sleep. And I continued on doing that, and until it was over almost a year when I was converted in that way. Said, you know what, I need to go to the company. I need to see these things. And then at that time, I was still taking 2 ounces twice a day, but from a pain level of 8 to 10, and coming down to a pain level of 4 to 6. That was fantastic. That was phenomenal for me. I was already a life change. Then I went to visit the factory. I went in Utah, and I saw Jim. Jim was there jugging around a whole bottle of Acia, just drinking it. And there were
I did
small.
not drink it from the bottle, Ed.
No, you took it yourself. You took there was
These cups, little cups.
yeah, and then there's small cups around there, and so I took 3 cups, and then I drink it at the same time, and so I was well. For me, it was great already. A pain level of 8 to 10 down to 4 to 6. But the thing is that after about 300 yards, 500 yards, I stop. I need to rest when I walk, and then I toured after that 6 ounces of Acia Redox that I drank. I toured that facility with no stopping. Just keep on walking, keep on walking. By the time I reached the bus and going back to the hotel, I said, wow, I did that one. And then when I reached the hotel, I still have a lot of energy left to really socialize with people. And I said, woo. So that made me realize that increasing the dose can do a lot more things for you. So I did, and so from that time on, I was on 4 ounces twice a day, and then when I have acute exacerbations of this discomfort in the back, then I just take extra. And so because I'm off all the meds, and then I have a meds that would say You take this, it's a long acting, and then you take this one also for short acting for rescue kind of thing. So my rescue drug, my rescue thing, and my long time really relief of whatever discomfort I have is just this. And I take it. And then I go cover for my colleagues now, but I'm just so blessed that I can do it again. From being disabled and hardly could walk without a walker, now to being able to run again from the sixth floor down to the ER where it's in the first floor, to do all those things again. And then of course I would feel it. I would feel it. I got rods and I got bone plates in the back and I got metal screws and this is no fun. And you'll have acute exacerbations of your discomfort. But to have this, that it will not make you woozy, it will just even give you more energy. It will not make you, it will not even confuse you for the things, and it will just help you more for other things. I am just so thankful that we have this technology. So, and I love this 4 ounces bottles that we have, and that's what I have bringing it whenever I go to work. I have those online. I got it in my
Yeah.
straps on right, two in each things. I have 2 cartridges on the left and 2 cartridges on the right side, and I just pop it in and whenever I need it. So
And no side effects like you got on your meds. So before Jerry started, I wanted to ask, how much did your mom do? Did
okay.
she stick with the 4 ounces or more?
No, she's just sticking to 4 ounces.
Okay.
We have a sibling of 6, and we have to approve, and my sibling has to approve it. And
Sure.
more of us in the medical field, so I'm overthrown, and
That's
so I
okay.
want to increase it, and I want it, but of
Sure.
course, the finances and everything is shared by all of us. But she did
Yeah.
well.
Yeah. But yeah.
So Jerry, go a little bit deeper, the disclaimer and why we even may have to say that, and just kind of your take on, I mean, that's one of the most phenomenal testimonials coming from a doctor that dealt with discomfort and helping other people get through theirs, and yet you had your own. I mean, and I was kind of having some bad withdrawals, quite frankly, because I was kind of reliving some of my stuff. So because those were not very pleasant days. But Jerry, dig a little bit deeper if you don't mind. You're muted.
We must hear Jerry.
What an honor to be here with you, Dr. De Los Reyes. When we met there in the airport, you are such a fine gentleman. And even under all that stress and all those sorts of things, you make us all feel better just by being here. Well, in my life experience, I'm a physical therapist, and this is a really interesting storyline because we all know that second surgical procedure is just a real tough one to get some success with. And I want to tell you all that this particular material called ARS, or ASEA redox signaling, and also its component partner, the Renew 28, or there are 4 different delivery systems of the same thing, is not in the same category of all the things we used to work with that were dangerous. And those dangerous things have governmental groups that will look after that, and they call them drugs. This does not work in that way. It's not in that category. But we need to say, because it has been placed in a category called a supplement, that we just want to remind you that it doesn't diagnose or treat or cure or heal or even prevent anything. But here's what it does do. It allows the miraculous systems in the body to remember how they used to work. All of us, I think, remember days back in the old days where stuff worked better. Didn't squeak and grunt and make noises and hurt. And like it does today. We were functionally higher energy, more focused, and hurt less. Well, you got a lot of that same equipment still there, but it turns out that if we can just allow the pieces and parts to talk to each other, it does some remarkable things. So if you'll all bear with me, and Dr. Reyes, it's just such a, do you like De Los Reyes or Reyes? I just want to make sure.
De Los Reyes, yes. It's
Yes, okay, good. Let's play a little bit. And what I'd like to do just in this rare moment is to talk between disciplines. And as we review the standard practice stuff that we had done for so long, what are you thinking now that you say, well, first off, you had your own personal experience of saying, this is not blocking anything. My treatment strategies are not working. What went through your head, and what were you trying to imagine that blocked you from being one of those better ones to the 10% that didn't work well?
Rephrase the question again.
Okay, why were you one that hurt when nobody else or the other 90% who had surgeries didn't hurt? What went through your mind when you, with your professional experience and so forth, saying, hey, they leave a pencil sharpener in my back or something? What were you thinking?
Well, I'm a man of faith, and I just really asked the Lord, what is the message here, Lord? Why 90% of the people would have great relief with this, and I belong to the 10%. Why me? I'm looking into a message from him, and why I have to experience this. But one thing that I took from that is that I have treated thousands of patients, and then really I have a lot that I have regretted when I experienced to become a patient. I did not really believe in their pain levels of 20 when they said, I only asked you from 0 to 10, and you tell me that. And in my own, I could say that too. And of course, this whole thing in medicine also, we could never say we're always right, and always and never. We never use those kind of words because it's not perfect. And but I accepted the failure that it happened to me. And when it happened to me, I said, I'm thankful that, Lord, you put me into the position of my patients, that there are more things that I could understand now that I never understood before, because I was just on the other side. And I was just saying, I'm listening to the complaints, I'm listening to this. So this is what they meant by this one. This is what they meant by, it's really a 10. No, I said, when you have a 10, a pain level of 10, you're almost dying. When I had that sense, that's why I said my pain level was at 8 to 10, because even if I'm not dying, I'm almost just like dying with all my sympathetics working, when all those things are just extending to my foot, extending to my to all my bodies now, instead of just in my back. This is no longer a discomfort in just the back, but it's a discomfort of the entire body, and your mental capacity cannot even cope it up. And and then you just give in. When you give in, that's it. You can't do a thing anymore. And that's when that depression comes in. That's when you lose things. When you lose your physical health, then your mental health follows up. After that, there's almost like you're a goner. You're really disabled. The only thing that's working in me is just my faith and just the prayers. And I think most of us experience these things because we have been praying a lot, and a lot of people has this molecules that is God's given really comes to you. And most of us that are really in distress like this one had prayed for something. And I prayed, and then an accountant came. It's my brother-in-law, and which I really did not believe. So I prayed, and I did not believe this was the answer to my prayer until 5 days after. And then years after, I still continuing to have benefits from it. And that's the good thing about, that's why every time I come back after a year and after a year, I always have different experiences with it. Even for me personally. So and as a physician, I've crossed bridges with this thing. Like you have 17 years of medical training, and so your mindset is just molded on how it thinks and how to do stuff. And when I have to live that discipline and cross and say, I'm going to try this. I'm going to do this. So that this is a condition that I'm just going to do with antibiotics. And because there's no other way to treat it except for really antibiotics. And then I would cross myself and say, you know what? I'm not going to use antibiotics for this. I'm just going to drink this. I'm just going to drink this every 2 hours or every hour. And I consume a bottle a day. And in 2.5 days, that supposedly 10 days relief with the traditional way of treating staph, you achieve it in 2.5 days. I said, what is this? And
well, this is really super. I think what you've discovered is the special prayer for healing accountants. Now, we did not know that existed. But maybe you need to publish that. So as we look at this modality, this material, these are things that I've often observed as well. That this perception of pain is a perception. We get a spinal cord injury, we could get damage in the same way, and we wouldn't feel it. We thought was purely neurologic, and then when we start to look at things like phantom limb pain, where a person's hurting in a place that got amputated and is no longer there. And we find that many of the people that we were treating for these areas of severe discomfort and pain, it didn't do any good. And so we think all of the mechanical things are in order. You looked at your x-rays and that sort of thing. And in practice, we kept finding there doesn't seem to be anything that works. But the body figured it out. And that is really remarkable in all of this, is that it's the body is built to fix itself. All of us, I think, can remember situations where you got broken, scraped, cut, burned, and it healed itself. Now, it was, as we get older and we find out there's more environmental influences, we get older, heavier, we also find out that we are slower in repair. All of a sudden, you were beginning to see things repair in speeds that used to occur when you were a little kid, but don't now. So as we start to paste all this together, here's the biggest thing. For most people, there are some, in my field of physical therapy, the compliance of the people out there is terrible. Of the things that we teach them to do when they go home for physical therapy, only 3% nationally actually do what you tell them to do. So I was thrilled when I found out that with the SIA, we had this really interesting capability for an experience that happens pretty quickly, is easy to learn. How long did it take you to learn to drink 4 ounces?
So 8 ounces?
Drink 4 ounces, just the beginning. You said, here's this blue bottle given to me by older uncle or cousin. And it's not difficult. It's easier than doing 3,000 crunches and running around the block 62 times.
Definitely.
You just drink it. Now,
just drink
there
it.
are some
Well, and-
caveats to that. You just swish it around, right?
Pretty easy. Yeah.
So it's a pretty much a miracle that somebody could have those experiences. And what it does is it opens doors so you can begin to start to do movement patterns in ways that you couldn't do before. And those movement patterns were more comfortable. Now that opens some really interesting doors from a theoretical standpoint, because that body wants to remember how it was functionally operational before, but there's something missing in the communication. Doesn't that seem logical?
Yes.
And so in our practices, we were looking for what is it that's missing in the communication. And the surprising, and Dr. Osler wrote a book on the first inklings that we're finding that help us to understand, hey, wait, there's more than they taught us in school. So Dr. Osler, when you began to start to dig into this and say, what's different about this? What were some of the big revelations for you that said, we never looked under that pillow before, and it's got a secret there? So what are some of those things you found when you started researching?
Yeah, the initial aha was just watching somebody else improve, namely my wife. And so that was the energy behind the deeper investigation, which was into the science to validate it. I wanted to know that this was real. And so understanding the movement of electrons along molecules and how these bioenergetic molecules that we talk about, how they interact with the cellular redox biology to turn on and turn off these pathway gene switches that are really what's controlling how our DNA responds, that our body's built to fix itself. Well, this is how it's built. It fixes itself because it turns on and off switches based on the cellular biology. And that's what this is a methodology that will turn on, or sometimes we use the word biohack. We're manipulating these switches to turn on command, on demand, at will, like when we want to. And that's really what lifestyle is about.
So it brings to mind when we were kids, we had these little race tracks for race cars, and they had two little electrical strips that were running down the racetrack. And if that race car got just a little bit off of the track, it wouldn't go anywhere. And so the body's making these attempts to try to do the healing that it knows how to do. It's missing something. So when the kid picks up the car and sets it on the track properly, and off it goes, it corrects the situation. So this magical thing called the body is actually fixing itself. It's wildly complex compared to all of our experiences. And we spent many years in the health field. And now all of a sudden we just say, if you give it what it needs, it gets the job done. What a new horizon that is. Because at a cellular level, since everything is made of cells, if it goes haywire, the cells were originally designed to fix themselves. Not only were they did, or they have many, many times over. Then it gets slower with age. That's one of the things we notice with aging, is that the cells have to last too long before they get somebody to come in and replace them. And that's why it took so long for some of those wounds to close, like your wife's finger through the fingernail. And then all of a sudden, it has a memory to do it. Wait a second, no magic, nothing different than it used to do it when it had better communication. So this is incredibly exciting from so many different angles. And I don't want to belabor the issue too much, but I'll let the rest of you ask questions. There are so many fantastic routes that we're going to be discovering based on this series of new way to look at biology. To my way of thinking, it is probably the most drastic improvement in the lenses we look at biology, and giving us so much more to create answers than basically since the beginning of biology. We've never been this close to being on track with how the body works. and having something to do with it that's so incredibly simple. I'm going to
That's
sign
awesome.
up again.
All right, guys, we got about 8 minutes. Thank you, Jerry, for that. And Lee and Dr. Ed, it says it's a dietary supplement made from salt water. And Ed, I counted 10 different things that you experienced. Someone asked in the chat, hey, can you explain real quick the rebalancing back to normal homeostasis, Lee? And Dr. Ed, did you have a hard time believing that dietary supplement made from salt water from Salt Lake City was real? Did you have any issues with that in the beginning? But Lee, why does this always work and it cannot not work?
Well, you asked an interesting question in the setup with that, like the homeostasis or going back to homeostasis. I think sometimes we make the mistake of thinking that life is about balance. And in the world of ASEA, I think we've been conditioned to think that way as well, is that this will always keep me balanced. And that's not the way the cells work. The cells are made to be responsive. If you could think of a fire department, the fire department people don't just sit around and let their skills or their readiness lapse. They are always on the ready. They're resilient. They're capable, and they practice it over and over. And then when the alarm rings, they're able to respond quickly, immediately, and they can match the threat, you see. But if they just sat around and said, well, we'll get to it someday, because they didn't want to upset their own apple cart, then responding to the stress or the problem that it comes along is a much more laborsome. And so the point that I'm making there is redox lifestyle, ASEA redox cell biology is about improving the resilience. It's improving the capability of being able to return to balance, not just stay in balance. And so that's why in our lifestyle, we continually press, we stress, we exercise, we fast. We're purposefully inducing a little bit of stress intermittently through the day, through the week, so that our cells are like, it's like we keep them guessing. They kind of don't know when the next threat's going to come along, so they have to be in the ready. They're always resilient. And that's really the secret magic to me of what this technology does for the body, is that it keeps us resilient. And it does that by being able to periodically flip these switches on and off so that we can have that capability to return there. I'll pass it over to Ed. Go ahead, Ed.
Yeah. So, of course, at first when I saw it, I didn't believe in the product. I didn't even care about researching and knowing it until I have great relief with it. And when I look at it, and I found Dr. Gary Samuelson talking about it, and when I saw it, salt and water, immediately you could relate to it that cells are bathed in salt and water, and then when the mitochondrium would work in assimilating all the foods that we eat and then converting it to energy, and that environment is salt and water, and that energy has a spark. And when that spark comes in, and then the redox signaling molecules also is being produced. So I believe in it that these are the very same molecules that is produced by our own mitochondrium. And so salt and water in there, yeah, that's the ingredient, but there's hardly salt that is left in that bottle, because it's all converted with the process of electrolysis and a series of electrolysis to produce other molecules from just those two simple ingredients that is found in the bottle. So.
Yeah, going back, Jim, just to your question, it's like the point is, this isn't about whether it's saline or not. Saline is the carrier vehicle that these bioenergized molecules are suspended in. And they're suspended in it because they're made from electrolyzed saline. That's where sodium and chloride and hydrogen and oxygen come from. So we printed on the side of the bottle that it says saline. We joke about, salt water from Salt Lake City, but that's the carrier. And it takes the spectroscopy machine to be able to analyze those energized molecules, which is not something that's in everybody's back kitchen. but it's there, and that's the vehicle that transports them into our body.
Here's a
Yeah,
fun from the factory, and this is from Hunter Dean. And basically, he said, when people look at that salt and water on the back of the label, he said, that's what's required. What are the ingredients that go into it? He said, this is the first supplement that we've ever seen that we can find where what makes it work is not the ingredient set, it's the process that the ingredients went through. Now that is a whole different universe, and one of the things that makes this so incredibly unique. The cool thing is it's available to all of us. Anyone who can rub it on or drink it and share with friends can use it. So it spells to us a new horizon of being able to make a difference in people's lives together as a group of people, and to change community, to change people who need to get squared away, whether it's time or meaning in their life. They want to just have some meaning, whether it's a person who does have the very significant physical difficulties. We all come together. Some people even have financial issues, weird, and some are going to have a lot more. And we come together, each one of us, at the weakness in that area. And the greatest part of it is coming together again as community and working together to solve problems. That's going to be the thing that's going to get us out of this hole, is believing in our creator and working together in community and making this thing happen.
That's right.
Thank you, Jim.
I had a quick comment. I was looking at our book above by Dr. Ward, Healthy Cells, Healthy Life. And right below it says, balancing redox for better health. And if you think about that, when you share redox with people, you need to set them up with proper expectations of when this balancing can happen. We say 90%, see it in 90 days. Jim started seeing changes in his first 3 days. Everybody's different. So people, it's not like a magic potion. Poof, it's all going to go away. You have to give the body time. You got to take enough, long enough. Plus, one person could be on paper healthy, eating healthy, they exercise. Someone else, maybe a couch potato, it could take longer. So you just don't know when you're going out there, use the Renew 28, give them an experience, but let them know that this is something you need to do every day. And, don't skip days, don't mix it with anything, and give the body time to do that balancing of redox. And then you can start seeing that optimal health.
Well, Dr. Ed gave us that lead that just said that the body will determine what to do first. It's got more ways and sensors to figure it out than we ever would. And we can come in there with a great big sack of hammers and try to fix stuff, or it can say, you don't have a dialed in this segment over here. We need to make 3 of these departments better here to provide us with the raw materials to do the thing you want to do over here. It's going to take me some time. Let's get this together. And the cool thing is we don't have to know that. It's like a farmer planting a seed. How much do you have to know how to grow the seed? Your job is to keep it from harm and to water it once in a while, but it does the magic by itself. The cells do the same thing, and it's awesome.
Exactly.
Okay, Lee, real quick, give us a medical disclosure, please. We don't use any medical terms. We don't use any machines or things like that, because I just saw one in the chat. Could you please, real quick, go why we don't do that?
We don't do that because this is a supplement, and so FDA supplement regulations govern the use of these supplements. Therefore, we don't make claims. We don't make. This is not about treating or curing or diagnosing any medical situations. And I believe that just based on some of the comments that I've also read in the chat, if there is a question about a specific malady, a health condition, the real issue is does that malady involve cells? If there is a cell that's not working well, we're probably going to have a disease condition show up someday. Or in reverse, we could say if there's an existing disease condition that is happening, it first began with cells that were not functioning or signaling properly. So this is one of those foundational, or we'll say upstream in the pathway discussions you correct the cellular signaling situations, and very often the downstream malady or health condition will rectify itself. But we're not making claims to that. We're just trying to improve the cell functioning, regardless of what it is.
That's it.
Thank you. Dr. De Los Reyes, thank you. It's
Always
always
awesome.
awesome. Your story is number 2 in realredoxresults.com. The password there is lowercase redox. There's now, I believe, 150 different testimonials there. We're here every Friday. Next Friday, we're really honored to have 5 nurses, RNs. They do a lot of the dirty work. They deserve a lot of credit, and we're going to have them with us next Friday.
And the 5th one I picked is Rosalie Brewster. She's never been on our show before, and she's going through a lot of effort because she's in a major time zone difference than United
sure.
States. So we're blessed that she's willing to do it in the middle of the night.
So I'm not medical. You guys all are. I'm an ex-stockbroker. And if somebody would have come to me and said, we've got a technology made from salt water that does everything that Dr. Ed just said, I would have said, you're nuts. But guys, it sounds like snake oil. It sounds too good to be true, but it's real. We have all the science to validate everything that we're talking about. We've got these medical experts, and included with nutrition, validating that this is real. What if it is? This is a game changer. It changes everything. There is nothing, Jerry brought it up. There is nothing as big as this to the medical community, to the wellness community, to the athletic community, to the beauty community, and to the business community. As an ex-financial advisor, the majority of people are hurting. They have no solution. They hate to ask themselves one question. If you had something happen to you today and you couldn't work another day, are you financially stable? If you cannot answer that positively, you need to take a look at this, because there's nothing like this on the planet. And Dr. Ed, I know you're building the global business. Dr. Osler, you, Dr. Jerry, you're my mentor. You and Terry Latham, we follow your pattern. So guys, thank you so much for your time, Lee, Jerry, and again, Dr. Ed. This is beautiful. This recording will be up in a matter of about an hour, hour and a half on Dr. Lee Osler's amazing site called redoxmatters.com. All the past recordings are there. God bless. Thank you all. Come back and see us next Friday, and bring somebody with you.
Yes.
Don't just come here and learn more and more and more. Share the truth. Share this. We have to get this out to the world. There's only, I think Alan Noble said, 4.3 billion people that we have to reach. We need help. Come join us. God bless. Get back to the one that got you on the call. Jerry, Lee, and Dr. Ed, thank you so much. God bless.
Thanks. Invite a nurse next week.
Nurse Week next week. God
Bye,
bless.
y'all.
Bye-bye.